All right, thanks for sticking around on this beautiful Saturday. My name is Jason Crowell. I'm a Parkinson specialist at the Norton Neuroscience Institute. First of all, what a great talk by Liz. Man, I feel so calm right now. If you all would prefer for me to just sit back down, we can ask Liz to lead us in some more meditation or imagery. We might all be better off for that. So I'm going to be talking today about some risk factors for Parkinson's disease, what causes Parkinson's disease. I was asked to give this talk a few weeks ago. I've been at Norton for the past year. I see folks every day in clinic out at Brownsboro. And this is something that comes up a lot in clinic. I feel like this is a thing that patients are frequently asking me about. How did I get this? Where did this come from? Why did I get this? So hopefully I'll try and shed some light on those things. My goal today is first to briefly just talk about the epidemiology of Parkinson's, and we'll talk a little bit about some of the genetics of the disease. One of the points is kind of a meta point, but a point that I think is important when we talk about risk factors in Parkinson's disease is this idea that causation is not the same thing as correlation. And we'll get into that in a minute, but I'm going to be talking about risk factors for Parkinson's, and we're going to want to, instinctively, we're going to want to draw some conclusions like, oh, people who smoke are less likely to get Parkinson's disease. Does that mean that I should go smoke? And of course the answer is no. But we have a cognitive bias to want to draw some conclusion between some of these risk factors, and we have to be careful to avoid doing that. So then we'll talk about some risk factors, of course, and then some protective factors against Parkinson's. So just a few words about epidemiology. Parkinson's is a common disease, right? So 3 out of 1,000 people in the world over the age of 40 have Parkinson's, over 6 million people living with it in the world, at least that have been diagnosed. Here in the US, there's probably around, when you look at most of the studies in the last couple of years, there's probably around 1 million people in the United States with Parkinson's disease, over 60,000 folks diagnosed a year. And the incidence, of course, goes up as we age, right? So from going from the 6th decade of life to the 9th decade of life, there's about a 5-fold increase in developing Parkinson's. And then by the time you reach age 85, for folks at age 85 and older, about 1 out of 25 men, so 4% of men, and then 2% of women have Parkinson's. So it's a really common disease. I thought this kind of graphically helps demonstrate some of the prevalence across the United States. So this was done 4 or 5 years ago by the Parkinson's Foundation, where they did a Parkinson's prevalence study. And we won't get into the details, but darker blue means more prevalent. And so if you look here at Kentucky, there's about 11,000 folks estimated in the state of Kentucky, in the Commonwealth of Kentucky, with Parkinson's, and then about 16,000 folks in Indiana. So a common disease. So when you look at the research about why did I develop Parkinson's, you'll come across this phrase that's used differently in different journals, but multifactorial is a word that you'll see a lot. And what exactly does that mean? And it's this idea that there's lots of potential causes. For any one given patient, it's hard to say what caused it. We know that about 10% of individuals with Parkinson's probably inherited their Parkinson's. So they inherited a gene from one of their parents, or maybe from both of their parents, and they developed the disease. But that means 90% of folks, maybe even more than that, at least as best we can tell at this point, don't have a clear genetic cause. So maybe they have some gene that increased their likelihood, and then maybe they had some environmental exposure, and maybe the combination of those things led to their Parkinson's. But for any given patient, it's really hard to say, to be able to just pinpoint and say, here's why you have Parkinson's. So you often see this word, multifactorial. So with that in mind, let's talk briefly about these 10% of individuals, individuals who probably inherited it. Again, most of the time, it is not an inherited disease. The individuals who do, quote unquote, inherit it, who received a gene that ultimately led to developing Parkinson's, It tends to occur more frequently in younger individuals. So folks that have early onset Parkinson's have a higher likelihood that they inherited it. They had a gene that they received that led to their Parkinson's. But I listed some genes up here, and we'll talk about them in a second. But one point to make is that, and this is confusing, but even if you inherit one of these genes, not everyone who inherits one of these genes goes on to develop Parkinson's. And that'll make you scratch your head a little bit. Well, why did someone who did inherit this gene develop Parkinson's, but then why did someone who developed it, who received this gene, not develop Parkinson's? And so again, it's complex. These are some of the more common genes that are thought to be causing Parkinson's disease. So SNCA, so the alpha-synuclein gene, was discovered back in 1997, and this gene goes on to develop a protein called alpha-synuclein, and this protein can accumulate in the brains of individuals with Parkinson's disease, and it forms clumps called Lewy bodies, and so this can go on to be associated with the disease. LRRK2 is responsible for about 1% to 2% of all cases of Parkinson's disease. It has an increased likelihood of causing it in individuals from certain sects of Ashkenazi Jews. Parkin is the name of a gene that is also one that likely causes early onset Parkinson's, usually in teenage years or the early 20s. PINK1 is another gene. It produces a protein. So there's all these genes out there that have been identified. More and more continue to be identified. But most of the folks who develop Parkinson's don't have one of these genes. And so, again, it's often a multifactorial cause. I wrote there at the bottom, what about a polygenetic cause? And that's kind of what I was speaking about earlier, is we have these few genes that, if you have one of these, that increase your risk significantly. But what if it's more than one gene? What if there's 2 or 3 genes working in combination? You know, I have these 3 genes, and none of them on their own, none of the mutations on their own will cause Parkinson's, but maybe the combination of the 3 or even the 4 or 10 of them. And that's obviously much tougher to detect. So work continues to go on with trying to identify these multigenetic causes of Parkinson's. We're not going to get into the details of this because I don't understand all the details of this. This is basically just to show that these different genetic mutations work in different ways. So they don't all cause the same consequences. They all act independently of one another to increase the risk of Parkinson's. So some of these have to do with increasing inflammation in the brain. Some of them have to do with the waste management system in the cells of the brain. So some of these mutations, if you have one of them like LRRK2, basically makes the waste management system in the cells of the brain break down, and so the brain can't clear waste like it should, and so protein will accumulate that's not supposed to be there, and that goes on to cause the disease. So before we talk about risk factors and protective factors, again, I want to hammer home this point that correlation is not causation. So this is a simple point, but we have to keep it in mind before we talk about these risk factors. So there's a cat sitting on this awning, as you can all see, and the awning has collapsed, right? Both of those things are unequivocally true, but does anyone think that the cat caused this awning to collapse? That's pretty unlikely, right? So we grasp that idea, right? That 2 things can both be true, but one doesn't necessarily cause the other. The cat's on the awning has collapsed, but the cat didn't cause it, right? Let's look at a graph. This is a graph of ice cream sales and shark attacks, right? So from January to December, there is a strong, strong correlation between ice cream sales and shark attacks. So what conclusion should we draw about that? Are the shark attacks causing people to buy more ice cream? No, that's absurd, right? And the inverse of that doesn't make sense either. Like, why would people going to buy ice cream increase the number of shark attacks? It doesn't make sense. These 2 things are correlated, but there's not one thing that it's not that one caused the other, right? So you can imagine, well, maybe there's a 3rd thing out here somewhere else that we're not talking about that causes both of these things, right? It's summer. Oh, well, if it's summer, we're going to sell more ice cream. People are more likely to have shark attacks. And so that's an important point for us to keep in mind here when we talk about some of these risk factors, because we're going to talk about them. We're going to say, well, this thing correlates very closely with Parkinson's disease. And instinctually, we want to say, oh, well, that must cause Parkinson's disease, but that's not necessarily true. Sometimes it might be true, but we can't, we have to be cautious before we imply that one thing causes the other. So let's talk about some risk factors. We're going to cover kind of 4 main categories here. And I know some of these have already been touched on maybe elsewhere today, but we're going to talk about some pesticides and chemicals. We'll talk about traumatic brain injury. We'll talk about dairy products, and then we will also talk about diabetes, and more broadly than diabetes, a syndrome called metabolic syndrome. So diabetes in conjunction with high cholesterol, high blood pressure, increased body mass. So let's start by talking about pesticides. So certain chemicals and pesticides can increase the risk of developing Parkinson's. And it's important to note that any exposure to pesticides, even if it is exposure to one of these chemicals that we know can cause Parkinson's, it only increases your risk by a very small amount. So let me say that again. Even if you have exposure to a certain pesticide that's likely to cause Parkinson's disease, it only increases your risk by a very small amount. They started to discover this back in the 1980s, that it wasn't just pesticides, but actually they found that folks who live in a rural environment or were exposed to well water had an increased risk of developing Parkinson's later in life. And so this has been studied over and over again, and they've slightly varied what they're measuring. So they've studied working as a farmer will increase your risk of Parkinson's, exposure to farm animals, living on a farm, exposure to pesticides, like we'll talk about, drinking well water. And then even some more quote-unquote passive exposures, like living in a rural area or living near a farm that's using pesticides. Those things can also be associated with an increased risk of Parkinson's. And so it's really hard to know, what's mediating these causes, because, people who drink well water, who work as farmers and live on a farm, they fall into multiple of these buckets. So what is it actually that's mediating this increased risk? And I said just on the last slide that we have to be careful about drawing links in causation between some of these things, but we can set that aside here, meaning that it's pretty well demonstrated that certain pesticides do cause. Not only are they correlated, but they actually do cause Parkinson's. And so in some animal models, when they're researching Parkinson's, they'll actually use some of these pesticides to induce Parkinson's disease in the animal model that they're trying to, say, study some drug. So this is one of the exceptions that where we actually can draw some pretty firm conclusions about causation. Paraquat is probably the best well-known pesticide that's linked with Parkinson's. It's banned in a lot of countries. Rotenone is another one that's linked with Parkinson's. So, for any one given patient who might have lived on a farm and might have been exposed to some farm animals that were around pesticides, it's hard to say, well, did that cause it? I don't know for any given individual patient, but at a group level, we know that exposure to these things will increase risk. Traumatic brain injury. So this is on the news all the time, right? The NFL season just started. Every week there's concussion protocols going on television. Traumatic brain injury is associated with an increased risk of Parkinson's disease. When we say traumatic brain injury or TBI, you almost have to drill down a little bit on what you mean by that, because that can mean a lot of different things to different people, right? So it could be something as simple as I hit my head on the cabinet and I had a headache and felt a little dizzy, so maybe a very mild traumatic brain injury, a mild concussion that didn't result in loss of consciousness, all the way to someone has a severe car accident and has a traumatic brain injury that results in loss of consciousness for over an hour. So there's a spectrum here when we talk about traumatic brain injury, but there was a study done with patients from the VA health system here in the US a couple of years ago, and they broke it down into mild, moderate, and severe. So mild meaning loss of consciousness, but less than 30 minutes, and then moderate to severe meaning loss of consciousness greater than 30 minutes. And what they found when they studied these patients from the VA system is that individuals who experienced a mild TBI, so had loss of consciousness, but it was less than 30 minutes, had an increased risk of about 50% of developing Parkinson's. Individuals who had moderate to severe TBI, so greater than 30-minute loss of consciousness, had an increased risk of about 80%. So a thing that's important to point out here is, that even if you have an increased risk of 50%, if you have a 1% risk of developing Parkinson's and it increases your risk by 50%, you're still only have a 1.5% chance of developing Parkinson's. So even having a TBI, it's certainly not a 1-to-1 ratio of, oh, you had a severe traumatic brain injury, now you've got a 100% chance of developing Parkinson's. It's much, much weaker than that. But it is, at a group population level, it is significant. So if you study folks who have these moderate to severe traumatic brain injuries, they do, compared to folks who don't have those, they do go on to have a higher risk of developing Parkinson's. And so, what's the take home from this? That things that we all should be doing anyway, right? Wearing our seatbelt in the car, for especially children and young adults who are playing contact sports, taking appropriate precautions with head injuries to avoid them and to prevent repeated head injuries. Dairy products. The association between dairy consumption and Parkinson's has been described a couple of times. The most recent report that I found was from back in 2017, and they looked at whether low-fat dairy was associated with an increased risk of Parkinson's. And that's what they found. So this was from the journal Neurology, excuse me, back in 2017, where they took a very large database of patients, over 100,000, and they followed these individuals with their diet, their lifestyle, and then to see whether or not they went on to develop Parkinson's. And what they found was that individuals who consumed at least 3 servings of low-fat dairy a day had a 34% increased chance of developing Parkinson's. So that was the headline from the study, was that total dairy intake was associated with an increased risk of Parkinson's. But one of the questions they talk about in this paper is it really the dairy, or maybe it's just the pesticides/chemicals that the cows were exposed to, right? We know that those have a pretty strong correlation with Parkinson's. Is it really something about milk, or is it actually just another way of measuring exposure to pesticides, which I think is a good question. And then diabetes, another risk factor, and not just diabetes, but something called metabolic syndrome. So most of us are familiar with diabetes and glucose. There's different types of diabetes. Some folks have the inability to produce insulin adequately, and that's type 1 diabetes, and then others can produce it, but they aren't able to use insulin. That's type 2 diabetes. And we know that diabetes, and specifically having elevated blood glucose levels, can cause neurological damage, right? A lot of people are familiar with diabetic peripheral neuropathy, so individuals who have numbness, tingling in their hands and feet after developing diabetes, where the high blood glucose levels can cause damage to nerves. So it's not that far of a stretch to imagine that maybe having high blood glucose levels can also cause damage to the brain, right? And so this has been studied. This was from back in 2018 in the journal Neurology, once again, where they found that individuals with type 2 diabetes had about a 30% increased chance of developing Parkinson's compared to the same individuals who did not have type 2 diabetes. So once again, this is not one-to-one. The vast majority of folks with type 2 diabetes do not go on to develop Parkinson's, but having type 2 diabetes does increase your risk. It is a risk factor. And so they've actually explored this idea by developing some clinical trials where they've given folks who have already developed Parkinson's medications, like diabetes medications, to try and increase a body's sensitivity to insulin, to lower glucose levels. But so far, those studies have not yet found any benefit in individuals with Parkinson's. So once again, it leaves us kind of scratching our head. Are these things related to one another just by correlation, or is one actually causing the other? And then, even more broadly than diabetes, again, there's a syndrome called metabolic syndrome. Some of you may be familiar with this. This is not just having high blood glucose, like in diabetes, but it's having high blood pressure, elevated levels of the bad cholesterol, low levels of the good cholesterol, and then an increased waist circumference. And so they did this study back in 2018. I know that you can't read the fine print there, but that's okay. The point was that having any of those 5 pieces of metabolic syndrome increased your risk of developing Parkinson's as time went on. And as you can see here, every time you add one of those components from metabolic syndrome, the risk goes up. So having high blood pressure, increased risk; having high levels of bad cholesterol; having low levels of good cholesterol; an increased waist circumference, and elevated blood glucose. So all of those ended up increasing risk. It was a small increase, but once again, it was statistically significant. So let's talk for a few minutes about some of the protective factors against Parkinson's. So, Liz was talking about the importance of exercise in folks who have Parkinson's disease, but there's also some evidence to suggest that being physically active can help lower the risk of Parkinson's. So we'll talk about that, as well as tobacco, coffee and caffeine, something called uric acid, and then flavonoids in the diet. So I'm into fitness. Fitness, whole pizza in my mouth. There have been several studies over the last few years that indicate that regular aerobic exercise is associated with a reduced risk of developing Parkinson's disease. Why might these two things be related? So let's hypothesize, why would being physically active lower one's risk of Parkinson's? And so there's at least a couple of possibilities. One, it's thought that maybe physical exercise can slow the neurodegeneration that happens in Parkinson's. Maybe it can prevent these dopamine-producing neurons to last a little longer. Maybe it's the case that exercise increases dopamine release in a way that prevents Parkinson's symptoms from developing. So you're exercising more, there's more dopamine, and it prevents or delays the onset of symptoms. Or thirdly, maybe exercise increases the release of growth factors that leads the brain to keep these dopamine-producing neurons alive longer. So let me play devil's advocate here and say, I would love to sell to you that increased physical activity might diminish the risk of Parkinson's, but what if it's the inverse? What if it's simply the case that when someone has Parkinson's disease, it's more difficult to move, it's harder to exercise, it's harder to walk, and so maybe folks with Parkinson's just exercise less, right? They have these symptoms that are causing slowness and stiffness of movement, and so they exercise less, and so maybe the arrow's pointing the other direction. So just a warning about drawing these hard conclusions when two things are correlated with one another. I took this picture a few weeks ago at the Kentucky State Fair of tobacco. So it's kind of an interesting one. This really catches people's attention when you tell them that cigarette smokers are less likely to develop Parkinson's. So that's right, the conclusion is go smoke. Of course not. Of course not, I'm joking. They've even looked at this in groups of twins where one twin goes on to develop Parkinson's and the other doesn't. And in a situation like that, you think, well, man, those are basically the same, as closely to one another as you can. They've got the same genes. They've probably been raised in the same environment. But what they find is that when you have a set of twins and one goes on to develop Parkinson's, the twin who smokes is less likely to get Parkinson's compared to the twin who doesn't smoke. So again, the take-home, smoking is always bad. I don't advocate smoking in any way. There's certainly no reason to start smoking, but it's been demonstrated over and over again, which is kind of interesting. There are many different chemicals in tobacco, and one of those is nicotine. And we have nicotinic receptors in the brain. So is it possible that smoking enhances these receptors and allows them to work more normally? And that's why folks that smoke more have less risk of Parkinson's, maybe. There have been a couple of trials looking at using nicotine and see if that's possibly useful in preventing Parkinson's, but that hasn't really shown any convincing results. That's my son, sorry, shameless, proud dad here. So coffee drinking and caffeine use are associated with a lower risk of Parkinson's. It's not exactly known whether or not caffeine is mediating this. There's another compound in coffee called EHT that might mediate this benefit. This EHT is linked to serotonin, which we know we have lots of serotonin receptors in the brain. Many of the antidepressants we use work on serotonin in the brain. And this EHT that's in coffee has also been shown to prevent misfolding of alpha-synuclein, which is part of the problem with Parkinson's. And so the thing about when you look at these caffeine or coffee studies is that most of the recommended dose of caffeine, all of us are already drinking between soft drinks and coffee and tea. So, there's certainly no reason to go out and start drinking energy drinks to raise your caffeine level to try and reduce your risk of Parkinson's. Urate or uric acid. So urate is an end product of metabolism in humans. It kind of acts like an antioxidant. And we know that oxidative damage or oxidative stress can contribute to Parkinson's. So one hypothesis is that maybe high levels of uric acid, this antioxidant, might protect someone from developing Parkinson's. And so that's continuing to be studied. There's one complicating factor for that, which is if you have too much uric acid, that's kind of what happens in gout. So this uric acid can accumulate in the body. It can deposit in the joints and your kidneys. But nevertheless, they've tried looking at drugs to see if maybe if you raise uric acid levels, that might help with Parkinson's. Inosine, some of you might have heard of this before. It's kind of like an over-the-counter supplement. But they did a study, this was just from last year, to answer the question that could you slow the progression of Parkinson's? Is there benefit in giving someone extra inosine? And so in this study that I have here, this was from the American Medical Association, where they took a group of patients, gave half of them inosine, gave half of them placebo. So in theory, they were raising uric acid levels in the population that got the over-the-counter supplement, but ultimately they didn't see any benefit in terms of Parkinson's. So again, still, there's an association, but is it really causing or is it just unrelated? And then lastly, this might be the question that I get the most is there a diet I should be following? It's a great question, and in general, yes, right? For any of us, a heart-healthy diet, Mediterranean diet. This was just from, I don't have the study up here, but there was a study just from March of this year that indicates that regularly consuming foods with flavonoids might reduce the risk of death for folks with Parkinson's. So there might be some degree of protection. Flavonoids are thought to reduce inflammation in the brain, and there's lots of foods that have flavonoids. So lots of berries, blackberries, raspberries, strawberries, blueberries, kale, red cabbage, citrus fruits, soybeans. And so again, the idea is if it's inflammation in the brain that's causing these dopamine cells in the brain to not work like they're supposed to, then maybe consuming foods with flavonoids can reduce the inflammation and help with Parkinson's symptoms. So wrapping up, again, correlation does not mean causation, right? What's chicken and what's the egg? Just because two things both are true doesn't mean that one caused the other. Just because folks who smoke are less likely to develop Parkinson's symptoms doesn't mean that we should go and start smoking to reduce our risk of Parkinson's. Again, everybody, there's all these questions about, I don't have a family history of Parkinson's, how did I get it? Again, only 10% of folks with Parkinson's, likely around 10%, had a clear identified genetic cause for developing the disease. Physical exercise is likely protective. Diabetes or metabolic syndrome, so high blood pressure, high bad cholesterol, low good cholesterol will probably increase risk. And again, still lots of studies ongoing to determine what's chicken, what's egg. Are these things both true and unrelated, or is one causing the other?